This is a unique healthcare enclave, and quite appropriately, it is named Mediciti. Mediciti Hospital has been rendering healthcare services to the less privileged populace of the socio-economically challenged regions of Rangareddy district, neighboring the city of Hyderabad in India. Mediciti is a result of the coming together of a group of non-resident Indian professionals, especially doctors, to create a center of excellence in their homeland for science, health, allied research and education in an initiative known popularly through its acronym SHARE. The SHARE initiative founded Mediciti initially as a specialty cardiothoracic hospital, and from its inception, the hospital forged and nurtured a collaboratory relationship with internationally reputed institutions and eminent professionals with the goal of setting new benchmarks in reaching the best of healthcare ethically and affordably to the most needy. The stark and harsh perception of the lacunae and missing links in healthcare at the grassroots level in the socio-economically challenged region prompted the conversion of the specialty hospital into a general hospital. The civil structure of the hospital itself underwent a sea change. The layout, designed for specialty care, was transformed into wards and outpatient services for the entire gamut of medical specializations, with a meticulous attention to the complexities of hospital management and delivery of holistic healthcare services. A unique outreach program complemented the physical reorganization of the hospital, and a new horizon was opened for the healthcare needs of thousands of the most deprived of India. Having achieved this, the allied research and education components of the SHARE vision now demanded focus. There was also the tangible need for contributing to medical education with a stress on the latest approaches and clinical practices. The Mediciti Institute of Medical Sciences commenced its first course during October 2002. There was the advantage of a well-managed and large general hospital in the expansive campus. However, the task of establishing an institution that would become a benchmark in keeping with the SHARE vision was enormous. Mediciti took on the challenge, keeping in mind constantly the best of international benchmarks and the guidelines of the Medical Council of India, which has been at the core of bringing India's healthcare services to contemporary standards against great odds. From outpatient department and casualty to diagnostics and wards, Mediciti has a seamless environment. State-of-the-art diagnostic and medical equipments have been installed. The Siemens CT scan, the latest laparoscopic, gastroscopic and other endoscopic setups, 2D echo, X-ray machines, bronchoscope, a most modern pathology laboratory, blood bank, the hospital's own oxygen plant, and ventilators are testimony to the spirit. The operation theatres ICUs, neonatal care facilities, all attest the commitment of Mediciti to its socially oriented philosophy and the best of healthcare facilities. Mediciti has 10 modern operation theatres, and to support the operation theatres is an international standard CSSD, which ensures supply of sterilized equipment in adequate quantity to the operation theatres. Diagnostic facilities are being constantly enlarged and upgraded. For example, a 800 MA X-ray machine is being added to the 300 MA and 500 MA machines already installed. The critically designed casualty department has its own operation theatre and ICU, making it self-contained to handle any emergency case. Today, Mediciti's facilities and infrastructure provide a unique healthcare setting accessed by rural and urban populace, virtually bridging the divide in Indian healthcare. The seamless integration of teaching and learning environments with a highly rated hospital is evident in the student responses.
I get personal care from a highly qualified staff. The well-established hospital gives me hands-on personal experience, and the various community service projects nurture my sense of patriotism. At Mediciti, I grow professionally and emotionally. At Mediciti, I have the edge to compete globally.
It has been a long and arduous journey. However, the gratification is there of having made significant contributions to Indian healthcare. Mediciti is about a philosophy, an approach, a commitment to providing healthcare and producing healthcare professionals in a way that reaches to the very grassroots, with a commitment to addressing our local problems by harnessing benchmark clinical practices, procedures, technology and best practice norms accepted internationally.